My answer generally is that apply to only one specialty, because you want to make sure there's a lot of consistency between what you're presenting to the program and your experiences. So, for example, if you're applying to family medicine, it's going to look very strange if all clinical experiences in your areas is from, say, hematology, oncology, and cardiology, because then they'll question, is this someone really interested in family medicine? Why am I seeing more internal medicine clinical experiences as opposed to family medicine experiences? That consistency becomes questionable if you're applying for many specialties. But I truly understand, for international medical graduates, we want to stay competitive. In this case scenario, if you're saying IM and FM, you can certainly make a case that if you have an interest, say, in the primary care aspect of medicine, then IM and FM is perfectly fine. And if even in an interview, you can always say that, hey, yes, I'm very much interested in the primary care aspect, and that's perfectly fine, both for IM and FM. It gets much, much tricky if you're applying for IM and psychiatry, because then your application is going to look all over the place. You're not going to be able to focus all your clinical experiences, for one specialty, because you're trying to apply to two different specialties. It becomes even more tricky because they have to apply to so many more programs. So they're applying to, say, 150 IM programs and another, say, 100 programs for FM. It just becomes more and more expensive also. So I would highly, highly suggest that we focus all our efforts into one specialty